let me welcome all of you to this 36th roundtable, and let me welcome our presenter, Iva Parvanova, who is going to introduce herself. But please, I don't know if you've attended the previous roundtables or not, but in case you have any questions, you can ask Iva straight away to enable this more interactive approach to running this. So I'll give the floor to Iva, and yeah, I hope everybody will enjoy it.
Thank you so much, Anya. 1 second, let me make sure. Should I share my screen or?
Yes, please share your screen and we can hear you properly, just to tell you that everything is fine in terms of.
Okay, great. Yeah. That's perfect. Okay, give me 1 second. I'm sorry, I just have multiple PowerPoint versions open. Okay, so it should now be fine. Yep. All right. So I'll very briefly introduce myself. First, I wanted to say thank you to Joseph for inviting me to present a paper which recently came out. I'm happy to share it in the chat in a second. And of course, thank you to Anya for joining from the UK at such an early time. Yes, I'm very happy to see all of you here today, and hopefully this will be a productive and interesting discussion for everyone. I'm also very glad that the format of the event allows for sort of interjections at any time. I myself come from a background in an economics department where this is the norm, so please feel free to raise your hand or, kind of let me know if there is something that is unclear or if there is something that you would like us to discuss in more detail.
I will just stop you here for a second because I realize I haven't introduced myself while we were on a camera. So my name is Anya Ankoska and I come from Leeds Beckett University, where I'm responsible for the anti-corruption curriculum. But going back to you, Eva.
Great. All right. So today I'll be presenting a paper titled Framing of Sensitive Topics in Surveys, Measuring Corruption in Healthcare. It's very self-explanatory. I'll be talking about how we frame corruption in surveys measuring prevalence of bribery specifically. So a little bit about myself. I just finished my PhD in experimental and health economics at the London School of Economics. My research is primarily focused on corruption in healthcare, which encompasses bribery in the doctor-patient relationship. I've written some papers on measurement, drivers, and deterrence, where I've mostly taken a social norms lens in this work. Happy to discuss this in more detail if that's of interest. I've also worked on conflicts of interest and pharmaceutical state capture, and particularly how pharmaceutical companies use civil society organizations to lobby on their behalf. And I'm currently working on mapping corruption risks across the supply chain of generic drugs, so essential medicines in low and middle income countries. However, I'm also currently a postdoctoral researcher in Guido Carli, which is a university in Rome, in a Horizon Europe project called Bridge Gap, where we work on mapping corruption risks across Europe, and we try to bridge the gap between academia and policy in terms of evidence and knowledge. So if you want to find out more about our project and our work, you can scan this or go to the website that I've linked on the slide. Okay, so why should we be interested in corruption in healthcare? I think for a lot of people, it's a very self-explanatory question, but quite often I have found myself, especially amongst healthcare related academics, having to defend the question of why we should care about healthcare as much as we care about any other why should we care about corruption as much as we care about any other healthcare priority? Well, corruption is really costly. So while it is very hard to measure the exact extent of it, we know that it costs around $500 billion annually, which of course disproportionately affects countries in the global south, making inequalities in health funding and resources in healthcare even more exacerbated. We also know that corruption is consequential for mortality and access to healthcare services. So there is really wide evidence on the impact of corruption on measures such as child and infant mortality, um, and other sort of NCD related, so non-communicable diseases related deaths, which are preventable. And lastly, corruption is really difficult to measure because of its sensitive nature. So this is not unique to healthcare, of course, but in the context of healthcare, and especially the doctor-patient relationship, which is so private and confidential, finding out about what actually happens behind closed doors is really complex and ridden with extra sensitivity and anxieties from the side of the patient when it comes to sharing their true experience. So the main approach to measuring corruption in healthcare is through surveys. And again, I'm talking about the prevalence of bribery and what we refer to in healthcare as informal payments. And I will talk about this in a little bit more detail in a second. But surveys are the main measurement approach, the main measurement tool. And they are quite essential. Of course, we know that they're imperfect, but they are used by stakeholders on the national level, on international level, and by academics as well. They're used to understand the experience of patients within the healthcare system. There's a vast array of surveys used by different stakeholders. I will briefly mention some of them in a second. But in addition to them being a useful tool, they're also a very highly publicized tool. So with a new cross-country survey, especially, I mean, the same happens with national ones as well, but they obviously gather way less sort of international media attention. But when a new cross-country survey is released, it tends to be widely reported in the media. And what I'm going to show now is very sort of Eurocentric, but whenever there's a new Eurobarometer, this is what happens, either with the Eurobarometer or with the Global Corruption Barometer. You see The Economist, The Guardian, Deutsche Welle. There's always this either reporting of who the best performers are, where there is no bribery in the healthcare system, and then comparing them to the worst performers, which are normally countries in Eastern Europe. But they're used to sort of gain public awareness across different social groups, and can create enough noise to start a policy discussion, which is quite important. And the last important part of the surveys is that when we report on the prevalence of petty corruption from the social norms literature, which again, I'm very happy to discuss in more detail if it's of interest, but from the social norms literature, we know that what patients think others like them are doing when they interact with the healthcare system will affect their own decision whether or not to engage in corruption. So the idea is that these sort of media reports and the noise around survey results, or just the prevalence that is being measured through survey, can impact and perpetuate further engagement in corruption by patients in the healthcare system. Okay, so why should we study survey framing? Again, for some of you here who might be working in measuring corruption, this is perhaps not a topic which needs to be discussed in too much detail, but I will still mention it and discuss it. So framing is particularly important in the measurement of sensitive topics, and that has been shown very widely in the case of topics such as harassment, discrimination, and other behaviors which might be seen as sensitive. As if one admits to participating in them, then that might lead to some social retributions, and that is the nature of a sensitive topic. So what has been found is, in general, when it comes to sensitive topics in general, what is found is that using neutral or forgiving language, so either stripping away any words carrying potential social stigma, but also saying, oh, so for this is what forgiving language refers to, saying something like, presenting more of a vignette, let's say. So saying something like, we know that many people engage in X behavior. Do you yourself engage in this behavior? So creating this sort of priming where you normalize the behavior and then you make it more likely that people will also share whether or not they have any experience with it. So corruption is definitely one of those sensitive topics, and we know that there is quite a lot of social desirability bias that arises in surveys measuring its prevalence. And as such, it's really important to understand how framing could interact and impact this. And another aspect, which I think is quite interesting, is that framing also impacts the measurement of socially constructed concepts, which carry different meanings across settings. And especially in the case of corruption, we know that what constitutes a bribe, let's say I'm from Bulgaria, what constitutes a bribe in Bulgaria is often not the case in Sweden. So in some countries, the definition is much more strict, much more sort of, overarching. You're not allowed to do this, this, and all of these we would consider a bribe. Whereas you go in other countries where perhaps the tolerance is a bit higher, and then there is a slightly different connotation. And that comes from really the fact that I personally hold, I am from the school of thought, which considers corruption to be a constructivist issue. And it is a socially constructed concept. There is no universality surrounding it. With that, framing can really impact the prevalence measures and what we find through surveys. There's quite a lot of research showing that cultural backgrounds of respondents can dictate how they perceive the question itself. So again, if you use words like bribery, what is bribery could be interpreted differently across contexts. And that is often dictated by the background of the societies that people find themselves in. So there is a great paper that looks at collectivist and individualist societies and discusses how that impacts the sort of the cultural frames that they utilize to understand survey questions. And this is something that is unfortunately not as well studied in the context of corruption. So I hope that perhaps using a cross-country design here could help shed some light and start a conversation on this topic. Okay. So corruption framing studies, there's been quite a few. I'm sorry. A lot of the framing literature in corruption comes from experimental studies, and in particular experiments which use sort of bribery games. And framing has been one of the sort of the experimental variables which authors change and play with in order to see how it impacts decisions to bribe or reciprocate bribes. So for example, some of the findings show that corruption-related terminology in game design, so when presenting a game design using words like bribery or bribing versus giving an extra payment or giving a gift, doesn't necessarily have an impact on the behavior of players. I myself have run an experiment like this, and you kind of see that even without using the words that are loaded, people still make up they understand when they're faced with an interaction. They understand what the interaction is. Then exchange is framed as bribes rather than gifts, increase the reciprocity. So this is in a slightly different game. So you can see that the evidence is mixed, but exchanges which are framed as bribes rather than gifts increase the reciprocity. So people felt more obligated to reciprocate a bribe rather than a sort of benign gift. However, the importance of framing has not necessarily been studied in the context of how people share their real life experience with bribery, informal payments across different sectors. So, as I said, in healthcare, we refer to bribery as, or petty corruption more broadly. We refer to it as informal payments, and this is there is an entire literature trying to define what an informal payment is. So this will not be my aim for today, but it really can include bribe, gifts, and any sort of cultural habits. So any informality falls under the umbrella term of informal payments. It includes unformalized additional payments, so anything that is not included in the official price of a service. All of these things using favors and personal connections. So when I'm saying informal payment, it really does not need to be an actual cash payment. It means any sort of exchange that is out of the traditional, let's say, purchasing or reimbursement of a health service. And the fact that there is such a disagreement in the literature on what is an informal payment is actually translated into the framing within surveys and affects, of course, how respondents perceive and will report these payments. So all measurement stakeholders, so again, here we're talking about national governments, international organizations, we're talking about academic, authors. They don't necessarily follow a uniform strategy when reporting, when measuring the prevalence of informal payments. But however, despite of that, often results are reported kind of interchangeably, unless you go through some sort of a really strict systematic review procedure. The results of these surveys, they're not contextualized enough to understand how the questions used in measuring the prevalence can actually affect the actual estimated prevalence. So despite all of this research, which I have mentioned so far on framing of corruption, framing of sensitive topics, there is no empirical evidence specifically focused on informal payments and corruption in healthcare. So this is what sort of motivated this paper. So here I've summarized some of the framing components used in questions across different surveys. And what you can see is that there's obviously different questions and different dimensions of context which are used to frame the question. So there is a question of where the payment is made, who is made by, why, how, when, and all of these things really contribute to how the question will be understood, whether the question will be understood uniformly, be it within the same country or especially across countries. Here, I'm not even talking about questions of translation, which I'm happy to discuss later, because that's obviously a big issue both within and cross-country surveys quite often. But these are the sort of dimensions that I argue should be taken into account when thinking about framing, and are quite often not really taken into account when reporting the results. So, for example, how was the informal payment made? Was it in cash or in kind? Quite often, this is not the way the question is asked, but instead it is asked, did you have to make an additional cash payment I will show you an example of a question like this. And recently in a lecture that me and my colleague, who I think is here, Dr. Letra Latini, we were talking about gender and corruption with students in Lewis. And a very important discussion came about on the gendered aspect of this framing and this question. But for example, if the question only includes cash payments, then in many settings, women who actually are the main contact point between the household and the healthcare system, because they take care of the children. This is especially true in low and middle income countries where, yes, where women have way more contact with healthcare, education systems, and so on. They are the ones that are most likely to make the informal payment in that case. However, they also have lesser access. They don't have as much access to disposable income. And as such, emphasizing only cash payments in your questions will completely distort their experience with informal payments. They would be much more likely to pay either in kind or unfortunately be victims of sextortions or any other types of unsolicited sort of favors, be it sexual or not. But the point is that specifying this in your question, while it is important to understand how many, let's say, informal payments are cash, including only something like this in your question, which sometimes happens in surveys, will create a huge bias depending on the context in which the survey is fielded. Then there is the question of when. So when is the payment made relative to treatment? And here there is a really interesting trade-off, which of course normally happens in survey design. So not specifying a period creates uncertainty, whereby people might recall something from 5 years ago, let's say, or so, but not recall earlier or more recent experience that they had. So it creates uncertainty about whether it is a problem right now, including a time frame. If you include a time frame which is very recent, let's say in the past month or so, then you're likely to miss out on a huge number of interactions that happened, in the near but not so near future, let's say within 6 to 12 months, because most healthcare, especially specialist healthcare, the likelihood is that you won't capture a huge amount of people who all had specialist appointments in the past month. So extending that, however, to include a longer time period, so let's say 12 months, I'm getting very nitty gritty here, but bear with me. Let's say including something like 12 months could lead to recall bias. So people might not remember their true experience that happened a year ago. So there is definitely a trade-off in this. And quite often it is not transparently discussed in the survey design of big international cross-country surveys measuring healthcare corruption. And then lastly, whom was the payment made to? So was it a doctor, a nurse, the administrative staff? And what was the reason for the payment? Was it coercion, gift, expectation, bribe, collusion? So was it, asking people to kind of declare why they made a payment? There are some surveys that do that, and most really don't necessarily do that. But disaggregating the prevalence based on who the payment was made to, and also why it was made, so understanding this disaggregated prevalence will actually help us design much more effective and efficient policies that target specific informal payments rather than the broad stroke healthcare policies that are often suggested to fight with informal payments, such as increasing spending, increasing the availability of doctors. Some of these might be helpful for some types of payments, but not for others. So understanding these discrepancies and these granularities when it comes to measuring corruption in healthcare is really important. Of course, on the other hand, it's completely understandable that every additional question and adding extra questions is actually very costly to survey design agencies and to survey fielding agencies. So there is, again, a trade-off in terms of accuracy and sort of granularity, and then cost efficiency. Yes, so I wanted to briefly also show some of the surveys, which are, some of the main surveys that measure corruption in healthcare. So we have the Life in Transition rounds 2 and 3. The new round doesn't actually have any questions on corruption, I believe. But so, for example, in the Life in Transition, which is from the European Bank for Reconstruction and Development, and it's a survey targeting sort of the post-communist region, so a lot of Central Asian countries, a lot of Eastern European countries. It makes they refer to petty corruption in healthcare as an unofficial payment or gift. But then in the same survey in round 3, they also talk about payments required for services that should be free. And that is a slightly different connotation that, the answers given to these questions could be different because of this framing discrepancies. Similarly, in the Global Corruption Barometer and in the Afrobarometer, it's informal payments are referred to as paying a bribe, giving a gift, or doing a favor. They also specify the type of health worker that this happens with. Specifically in the Middle Eastern and North African region, they talk about wasta, which could also be taken as a type of informal payment. They do here obviously use a very contextualized terminology. And the last 2 surveys that I give as an example here are national surveys. They're the Russian Longitudinal Monitoring Survey and the equivalent of this in China. So in Russia, there's actually a lot of questions on informal payments, and they talk about, so here, for example, it is a hand-to-hand monetary transaction. So see, it's like an emphasis on the monetary aspect of the payment. But interestingly, in this survey, they actually disaggregate based on the type of care, and they change the time frame based on that. And then in China, again, similar to the MENA region, they really use a contextualized sort of specific term, which I think people in China would probably be way more aware of than, let's say, using something like an informal payment, which is red envelope. However, the survey that I wanted to talk to you about today is actually the Eurobarometer survey. And in particular, it's the Eurobarometer, which is the 79.1 or 397. It was fielded in 2013. It was published in 2014. And what I found very interesting is that in the years prior to the survey, there was only one question on corruption in healthcare, which asked respondents whether over the past 12 months, if anyone in their country asked them or expected them to pay a bribe for their services. For those of you not aware with the Eurobarometer, they sort of list a bunch of services, and one of those services is the public healthcare sector. Then after 2013 or 14, well, actually, no. In 2013 and 14, they introduced a second question. They introduced actually an entire new section which talks about corruption in healthcare specifically. So this includes questions about, having access to the healthcare sector, whether or not you have given an extra payment or a valuable gift, or whether you've made a donation to the hospital. And that's completely separately from the bribery section, which includes healthcare as well as other services. So all of a sudden, there are 2 very different questions which use completely different framing in the Eurobarometer. And one refers to corruption as an extra payment or a valuable gift or making a donation, whereas the other one just uses the terminology of bribery. And importantly, this only happened in 1 year, because the year after, the bribe question was completely removed. And in fact, then all questions about corruption in the Eurobarometer started using you know, the language of giving a gift, favor, or extra money. So there was no more loaded framing, which is why I found this year to be quite interesting. And it made me think, okay, well, the same people were given two different questions. They were asked, have you used a healthcare service, any healthcare services in the past 12 months? And also, have you given a gift or an extra payment versus have you given a bribe? So I first started doing a little descriptive analysis. So nothing causal, just kind of understanding, you know, how does the prevalence of informal payments differ across these two framings? Because there is quite a rich, there's quite rich data in the Eurobarometer. Of course, there's not that many people in the vast majority of the EU who have given informal payments. So most of the observations really come from Central and Eastern European countries in the Union. But essentially what we try to do is, if this is the flow of the Eurobarometer survey, we looked at people who had said yes to both of the use questions. So first people were asked, have you used the healthcare services? They were asked two separate questions about this. One before the neutral framing. So what we refer to as neutral framing is the question talking about informal payments as an you know, extra payment or a valuable gift, and one before the loaded framing, which is what we call the question using the terminology related to corruption, such as bribery. So people were asked a question about their healthcare use before each of these questions. So we only used those people of the Eurobarometer who had said yes to both of these questions. So people who had then seen both the neutral framed question and the loaded framed question. Those are the only people that remained in our sample. And what we found is here, I mean, this, let me very quickly maybe explain this, and feel free to let me know if this is in any way unclear. But what we found is that if we take the prevalence per country, and I mean, for those of you who have worked with the Eurobarometer, I have left Germany divided as West and East, as is often done in the Eurobarometer, unfortunately. But regardless, this is a small point, which I'm sure we can discuss in limitations. So we took the prevalence that is estimated through the neutral question, and we took the prevalence that is estimated through the loaded question. We took the difference, so the neutral minus the loaded prevalence, and we plotted it together with its 95 confidence intervals on this graph. So what we found is that generally across the sample, when we pool the sample of all countries, there is a higher prevalence of people who have said they have made an informal payment when they were asked the neutral question rather than the loaded question, which is to be expected. I think, you know, when I've already as I've already talked about sensitive topics, using neutral language tends to elicit perhaps people sharing more truthfully their experience or just more. So therefore, we estimated a higher prevalence. That was not necessarily a surprise. The surprise came from disaggregating these results by country, which is what you see in this graph, and seeing that there are outliers on both sides of the null axis. So the null axis, this sort of, I don't know if you can see my mouse, but the null line, it's where there's no difference. So all of the bars which cross the null line, there's no significant difference. But the ones that do not cross the null line, we find that there is a significant difference in the prevalence estimated from the two questions. So interestingly,
sorry, Eva, can I just
yes,
ask you a question? Maybe for people that don't understand the line, yes, we could see your cursor. Maybe
okay,
you
perfect.
could refer to like left and the right side, or if you could just
Absolutely,
a bit more
yes,
clarification.
that makes a lot of sense. Yes. So on the left-hand side, yes, thank you, Anya. That actually makes a lot of sense. On the left-hand side, there are the countries, again, where there is no crossing of this sort of vertical null line. On the left-hand side, there are the countries where the prevalence estimated from the loaded questions is higher. And on the right-hand side, it's the countries for which the prevalence estimated from the neutral questions is higher. So most of the countries where there is a significant difference are on the right-hand side. They're on the neutral higher prevalence side, as expected, as it is in the pooled sample. However, again, there
Great,
are the
thank you.
discrepancies.
Sorry, I think there is Peter
Yeah.
has muted themselves. Would you
Yes,
like to ask a
please.
question, Peter?
Yeah.
No. Okay, in this case, I'm going to mute Peter,
Okay.
and then we
Perfect.
can come back to it. Thank you.
Okay, great. So yes, so what we were very interested in are these outliers, such as, for example, Poland, where the difference is actually minus 7 percentage point, meaning that the prevalence estimated using the loaded framing is 7 percentage points higher in Poland than the prevalence estimated using the neutral questions. And then on the other hand, we have, for example, Romania, which is the red circle on the right-hand side, where there is a 5% plus 5 percentage points difference, meaning that the prevalence estimating using the neutral framing is 5 percentage points higher than that using the loaded framing. So we try to understand this sort of division. And of course, for some of the countries, it's, I mean, for a lot of those countries, it's sort of in the middle and there is no significant difference. But in some cases, like in the Nordic countries, there was one person who had said yes to the neutral framing because perhaps they gave a gift, and of course, 0 people who gave a bribe. So those country samples are very small and it's very hard to actually infer anything from them. But especially country samples like Romania and Poland, where actually informal payments are quite prevalent, there were a good number of observations there. Of course, still not possible for us to infer anything causally, which we tried to do later on in the second part of the study, but creates an interesting discrepancy, an interesting dichotomy between the two framings, which we tried to explain by mapping these results and this sort of ranking together with the CPI, of course, with the corruption perceptions index or the sort of the underlying corruption levels in the country. And of course, you can see sort of from the ranking of the countries that there is no particular link between these. We also try to kind of disaggregate based on regional differences. But again, as with the example of Poland and Romania, two Eastern European countries, they're on the two polar sides of this diagram. So it's actually very hard to understand the what could potentially be driving these results. We also went back to the surveys, of course, to double check that the translations match across countries. So we took the survey, the questionnaires in each language, reverse translated it, and everything was completely fine. The Eurobarometer, of course, uses these sort of very literal translations. So there must be something else. And I would be very interested to hear your thoughts on this as well. But before that, I'll very briefly also talk about the causal side of this. So once we saw this, we were like, okay, well, these results are interesting, but unfortunately, they're not causal. There is nothing we can sort of infer causally from them. So instead, we decided to run a very sort of simple survey experiment with respondents in the UK and in Bulgaria, where we recruited 2 representative samples of 400 plus people in each country. And we ran a survey experiment using the same questions as we did in the Eurobarometer. And why we chose Bulgaria and the UK? Well, the countries are, firstly, the two countries have very different levels of corruption and regulatory approaches when it comes to addressing informal payments. So in neither country, there is particular, like, specific legislation against informal payments. But for example, in the UK, the general medical contract, which is the sort of the professional ethics and professional regulatory text of medical practitioners, specifically talks about what a doctor or a health professional in general is supposed to do when receiving a payment or a gift, solicited or not, from a patient. So the reporting procedures, the absolute like sort of upper bound of in terms of value of a gift that a doctor is allowed to receive, and so on. And in general, the regulation in the UK when it comes to receiving gifts from patients is quite strict. On the other hand, when it comes to Bulgaria, the ethics code of health professionals mentions absolutely nothing related to gifts, favors, bribes, payments. We did like a very extensive search of any term that could be at all linked to an informal payment, or how to mitigate or report it. And there was nothing in any sort of professional text dictating the ethics or the behavior of health professionals in Bulgaria. While both countries, have a version of a bribery act, when it comes to healthcare specifically, there isn't anything necessarily that is codified in Bulgaria as opposed to the UK. So this is why we chose. I mean, of course, on top of this, the two countries have very different levels of corruption in healthcare specifically, and very different levels of informal payments recorded. So we wanted to see whether these sort of contextual differences could be driving some of the results that we were seeing. So participants in each country were randomly assigned to either the neutral or the loaded framing. Let me show you the flow of our survey. So we removed this problem which we had with the two healthcare questions, and we combined it all into one. So all participants in our survey were asked if they had been to a public healthcare practitioner, such as a GP, or a public healthcare institution in the past 12 months. Those who said yes were then randomly assigned into one of the framing groups. So they were either asked a neutrally framed question. So again, apart from the official fees, that you have to give an extra payment, a valuable gift, to a nurse or a doctor, or make a donation to the hospital. We used the exact same questions as the Eurobarometer did. And then the loaded question, which is in the past 12 months, has anyone in the UK or Bulgaria asked you or expected you to pay a bribe for these services, meaning the healthcare services. So you can see that in total, we had about 600 people who had used the healthcare system out of approximately 850. We had about 600 people who had used the healthcare services in the past 12 months. And then they were divided 380 into the neutral and 297 into the loaded. Again, this happened at random, which is essential for an experiment to be able to infer causality. And then from there, we also asked people about their beliefs about others like them. So we asked them whether they think that people like them had to give a gift or an extra payment, a valuable gift, or whether they thought that people like them had to pay a bribe. So the same question, but not about them, but instead about people like them, because we wanted to capture something related to norms, which I will very briefly talk about because it's not necessarily the point of this presentation today.
Iva, can I ask you a question?
Yes, you can.
I'm just thinking, because if those questions are around whether you've been to a public healthcare practitioner, such as a GP or public healthcare institution in the past 12 months, your work and subsequently or stemming from the barometer study, essentially it just asks about a single occasion, right? It doesn't ask anywhere about multiple occasion, or does it?
Yes. So here it's not about the frequency of paying informally. That's a great point. And unfortunately, there is only really one survey, which again is the Russian longitudinal monitoring survey, which has questions that refer to the frequency of paying informally. But most surveys don't really do that. They're trying to capture prevalence, not in terms of how many informal payments have been made necessarily, but what share of the patient population engages in informal payments.
No, that makes sense, but it just makes me also think that it could be that a person has, obviously this is linked to your
Absolutely.
limitations, that you know what I'm thinking, probably that maybe that
No,
somebody has
absolutely. Yeah.
asked a person 3 times to pay a bribe for the service, and then they would, going back to the bias that you were talking about, recall bias and so on. So yeah, I just wanted to clarify this.
I mean,
Thank
but
you.
it also, no, absolutely. But it also, the problem that comes with it is that you're not really capturing the intensity of the informal payments, meaning that, if you only pay once because you have one acute case, it's a very different picture and it calls for very different policies. And it also really, it means something very different to the healthcare system if you have one acute case and you pay once versus, let's say, having chronic conditions and having to pay every single time you have access, you have contact with the healthcare system. So these are two very, very different problems, but unfortunately, we don't really disaggregate them, and it hasn't been part of this. But yeah, this is a very good point. And on top of everything, as you mentioned, there is the recall bias of the time frame.
Yeah.
Yeah. So yes, so this is related to the second round of questions here, which is related to people like you. So the descriptive norm. So what is a descriptive norm in the literature? Is referred to what I think others like me are doing in a given scenario. So for example, when it comes to informal payments, how often do I think, or do I think that many other people like me pay informal payments when they have contact with the healthcare system? And so we wanted to see whether using different framing affects how people report on this. And you kind of cannot see it really in the graph because of the crossing confidence intervals. But in fact, there is a significant difference in Bulgaria and in the pooled sample, where the neutral framing in general leads to a much higher prevalence of people, let's say prevalence of beliefs about informal payments. So if people are asked a neutral question, many more of them are likely to say that they think that others like them are engaging in informal payments, versus if you frame an informal payment as a bribe. And of course, the difference between Bulgaria and the UK is huge, as we expected. And our results, however, are only significant in Bulgaria, but not in the UK, which could be because of the small small sample size in Bulgaria of people in the UK, I'm sorry, of people who had actually engaged with informal payments. But in any case, in the UK, it's a very, very small number of people, and so it's hard to actually infer any significant results. However, in Bulgaria, as I said, 44% of the people believe that others like them were engaging in informal payments. And what we found is that, which is actually more than the real number of people who reported engaging in informal payments, which I thought was quite interesting. When we then went back to the experiences and seeing what people shared about their own experiences, again, we found the same thing, which is in Bulgaria, we found significant results in the pooled samples. So pooling the two countries together, we found significant results, significant differences, but not in the UK. And the significance here really showed us that the neutral framing led to higher estimated prevalence. So in both Bulgaria and in the pooled sample, when people were asked the neutral question, they reported paying informally more so than when compared to those who were asked the loaded question. Importantly, however, the countries that we used, and this is something which we started thinking about post factum, if we go back to this, the countries that we used, unfortunately, were not those on the left-hand side, which is where it would have really been interesting to see the comparison. So something like Poland or Hungary, it would have been interesting to really kind of see how experimentally the framings work there. So seeing the causal effect of the framings. But for resource purposes, we were not able to expand the surveys to Poland as well. So I'll very briefly discuss the results and kind of what we found from this paper. But again, I'm very happy and looking forward to maybe continuing the conversation with you after a couple of slides. But yes, we found that neutral framing leads to higher self-reported prevalence of informal payments in Bulgaria, but also in most of the countries from the Eurobarometer sample. However, we do need more research to understand the role played by the cultural and normative context, and especially, again, the difference between the left and the right-hand side, which we see in the Eurobarometer results. And it's important to understand how this trade-off in cross-country surveys, such as the Eurobarometer, can be circumvented in a way, or can be, we can address it. Because let's say, I'm sorry, I'm just going to go back very quickly to this graph. Currently, the Eurobarometer, as I've showed you, it has dropped any bribery question. So it only uses neutral framing. Well, we don't know for sure whether, any observations will be lost. The countries which are on the left-hand side of this diagram, where respondents are much more likely to respond yes when they're asked whether they've paid a bribe versus whether they have given a gift, these observations could perhaps be lost if we sort of create this uniform, neutral framing. So while most countries will get, perhaps a more accurate representation from the surveys, there will still be some countries where this is not the case. So, should we aim for these universal cross-country surveys, such as the Eurobarometer, which are much more cost efficient, and kind of put the same umbrella terminology across different settings, or should we find context-specific, terminology that is understood by the local population, but also reflects their experience more accurately? Another potential aspect which we observe in our paper here is what in some health-related papers is discussed as the aesthetics of deception. So people tend to, use sort of morally positive kind of explanations and completely disconnecting their own behavior from wrongdoing, such as corruption, when they think about their own actions. So, they might see someone else giving an informal payment and say, well, this is a bribe, but then look at themselves doing it and say, well, I just did it because I wanted to express my gratitude, and this is a gift. So on the one hand, it could create arguably a situation in which we increase the moral permissibility of actions such as informal payments by, in a way, neutralizing the conversations around it, talking about it as a gift or as an additional payment, rather than what it really is, which in most cases it is a bribe. We found that framing influenced the beliefs of participants about how others engage with the healthcare system. So whether others like them pay informal payments or not. And based on other literature, other papers which I've written on social norms, the next step here would be to create this, what is called a mediation analysis, to understand whether the framing results that we observe when people share their own experiences, when people talk about whether they have made an informal payment, whether this is actually driven by how framing impacts their beliefs about others. So whether what is called again a descriptive norm is the mediator in this framing effect on self-reported experiences. But this is a methodological, perhaps, next point. Of course, as we have said, these findings really highlight the need for consideration of question framing, continuity of question framing across time, across countries, and especially consistency when reporting prevalences. So what I found quite interesting is that looking at the report of the Eurobarometer from this year, the 2013-14 Eurobarometer on corruption, you have these two questions which are very different, which lead to very different prevalences in some countries. Again, we're talking about 5-7 percentage point differences in some places. Which of these prevalences is correct? And how is it reported by the European Commission? And what I found in the report is that often, and even in years after that, when the word bribery is removed, the report by the European Commission really talks about bribery interchangeably, without taking into account that some of the questions used actually did not ask respondents about bribes, and in fact asked them about gifts, additional payments, and donations. And the answers that the same respondents gave when it came to bribes were actually quite different.
Eva, there are some questions in the discussion. Let me read them out. So Adalberto says that given is a point quite related to framing, could you tell us something about technique of data collection? You've got CAPI and CATI in brackets.
Yes, well, so this is something that we didn't even touch on in this paper when it came to the data collection modes, because when it comes to sensitive topics, I mean, that's a whole different set of trade-offs that you face when you choose between different types of data collection modes. We used sort of self-administered online surveys here, with the idea, and this is actually one of our limitations, is that we use the commercial panel provider, which actually also a lot of survey agencies use quite often, but we use the commercial panel provider for the experiment, which could potentially limit the generalizability of the findings. But we made sure that everything is representative, nationally representative. But yeah, no, we have not discussed the mode of survey data collection here too much, but you're absolutely right. This is very interesting.
And then there's a question from David Sotola that reads, framing influence is definitely of important consideration in designing survey research. How do you think neutral framing could apply more broadly, particularly in the context of bribe versus informal gifting? Do you consider how the neutral framing relates to the country cultural gifting contexts? Gifting giving is cultural in some contexts and might not necessarily be naturally interpreted as extortion or bribe. This was actually quite similar to the question I had.
Yeah, so I will just maybe just stop sharing the screen because it's actually the slides are done. So yeah, so I completely agree, and I think that this is one of the main drivers, perhaps, is that there is such a difference in the culture of gift giving, and the acceptability of gift giving. And so when you ask someone, have you given a gift? They're totally okay with saying yes, because this is something that they know everyone around them does. However, and this is the sort of the aesthetic of deception argument is that by continuing to call it a gift, yes, it obviously helps us measure it better, but surveys can actually kind of, there's very interesting literature on the topic, how surveys can feed back into the social understandings of different sensitive topics and exchanges, or just general socially constructed yes, let's say topics. So for example, I mean, this is very off topic, but how a survey refers to gender can have an impact on how society then, if a society is every year being asked the same survey questions about gender, it will start feeding into their understandings of gender. So if a society is constantly being asked about giving gifts, they will start understanding and thinking about these exchanges as gifts. So it can feed back into society. So I think, well, yes, using these neutral framing in contexts where gift giving is very common helps us understand it better, but it also could potentially perpetuate it further, and could normalize it further by sort of, again, emphasizing the idea that it is not a bribe, it is just a gift. So yeah, I think maybe more discussions on this would be very, very interesting. I don't know if I answered the question at all, but hopefully, I'm very happy to hear back, to not only maybe you be the only one speaking. It would be great. So people feel
And
free
this
to
is
ask the question.
yeah, and this is something I wanted to ask people. So obviously you can put your question in the chat, but also feel free to unmute yourselves. I think with the debate around framing in general, when you said, well, I don't know if you answered the question, I think you have, but also there could be another 3 hours of talking around it, and we still wouldn't address everything, right? Given that it seems to me that we've got quite a lot of, people with different backgrounds here, and knowing that the roundtable, at the roundtable, there are different types of people. It'd be great if people could share. Also, responding to what one of our participants, Dina, said. Yes, please make comments after the presentation. I think it's time now for us to open a wider debate. I feel like if we do have some time towards the end, we could ask Iva to go through some of the limitations, because I don't think you've gone through them. Like you had a full slide that you've kind of skipped. Obviously, we talked about limitations as you were discussing the design and the entire paper and so on. But in case we have time, we can go back to limitations. But for now, do we have anybody else who would like to ask a question, or do you? Is there anybody who would like to input into this discussion, please?
Hi, I would like to come in, if that's okay.
Yeah, please.
So thank you, Eva. This was really fascinating. And I'm very happy to see this group. I think it's really important to have this discussion on how do we define this concept and so forth. And before I say anything and ask my questions, and I've always wondered why we don't have more discussion around standardization across settings and countries. And I think part of it's at country level, the lack of definition, I think sometimes is intentional. It's political economy issue. If you leave things undefined, you don't have to have policies addressing them, and you could keep them fluid and bringing money. At least that's what we see in some sub-Saharan countries. There is reluctance to actually penalize, because then you deprive the health sector of a very important resource, which often sustains it. So in terms of, I really liked how you described the different types of capturing informal payments, including the descriptive norms. We've been using this quite a lot in quantitative and qualitative research. When you ask people, what do people normally do in your setting? But beyond the neutral, and maybe it's again part of neutral, but in many settings, low and middle income countries, corruption, informal payments particularly, are coping strategies. So if you ask people, it could be even positive, how did you cope? So if you imply that actually it's how it is, and you have not done something wrong because you're helping your family or helping survival very often. So yeah, there is a lot of literature around coping strategies. Informal payments is a coping in failed healthcare systems where the essential services are not maintained. But one other thing that I just wanted to ask you a question, one thing that you didn't mention and we've used in surveys, and it's shown, it's coming from the economic literature, but the willingness to pay study. So it's very interesting. There is very often high correlation when you ask people, are you willing to pay for this service? It's actually very correlated with levels of what people pay informally. So I think that's quite, we've used it occasionally, but I don't know systematically whether you can say something about that. My other point, another point in terms of measurement, I wanted to ask you again, is there literature on that? And I think Anya and some of the other people alluded to that. So we deal with patients that have extremely complex pathways, for example, non-communicable disease, where patients are in the system for life. So we have a massive challenge of capturing informal payments because it's often not for every service. It's often paid at certain times, and then it's like insurance for the future for particular doctor or particular service. So it's really difficult to have a good instrument because recall, but also people may have paid something 5 years ago when they entered into the system and they created relationship with the doctor. How do we even capture that? So I was wondering, is there something about new technologies we've tried to think about? We even had an app. It was measuring more patient experience, but something like that I was thinking could be used for also capture payments they've made. So we had an app which automated and collected the feedback automatically. So you don't have to interview them all the time, and they were able to send this via normal phone, not smartphone. So these are my two things for willingness to pay studies relevance and also the complex pathways. Thank you.
Before
No, thank you
Eva,
so much.
sorry,
Yeah.
I just want to say before Eva responds, I should have thought about it before, but I'm sorry I haven't. But it might be a good idea, especially given that we're talking about context and framing, for people if they're willing to tell us what kind of background they come from or what's their affiliation, because obviously, like Dina now has shared some of her insights. I'm sure that this also, this could be insightful and this could bring some light into the discussion. So if Dina, if you're happy to just tell us what institution or who you're affiliated with. I'm sorry. Yeah.
Of course. I'm Dina Parvanova. I'm professor of health systems and policy at the London School of Hygiene and Tropical Medicine. And in the past 6-7 years, I've been leading a program, different projects on health sector corruption. And of course, I come from Bulgaria. And again, my PhD, part of my PhD was looking at informal payments. But for many years, I didn't do much on corruption because I think there wasn't funding or political will. So it's only in the past 6-7 years we see this interest. And at the moment, I'm co-leading a Lancet Commission on anti-corruption in health, and Iva is involved in that as well.
Great, thank you.
Yes, just a very brief note. That is why I had the slide on why is corruption in healthcare important, because it's still, sometimes you have to defend why it is important. But just to go back to Dina's question. So on the first question, sort of talking about the informal payments as a coping strategy and measuring them through willingness to pay type of questions, I think, especially when it comes to the coping strategy, I think this really feeds super well into the literature on forgiving language and the vignettes that a lot of sort of different types of literature use when it comes to measuring sensitive topics outside of corruption. Again, if we're talking things like harassment or discrimination, these are the types of approaches that are commonly used in the literature. So it's again, it's more of a vignette even, and it's talking about, we know that a lot of people cope. So even using words such as coping, it already eliminates so much of the stigma, because you're talking about a different type of behavior. You're not a bad person for doing it, right? Like, it's excusing it. So I think there's a lot to be done with that, but unfortunately, as you know, a lot of these sort of more standard surveys, which are the cross-country surveys, they don't really use vignettes or even vignette-like approaches. It's really just, have you done this? And that is the end of the question, rather than thinking about elicitation a bit more in a bit more of a complex manner. And I think it would be really, really interesting to try the effect of different types of vignettes.
I think a few studies used it in not just as a vignette, but as a question. Would you pay? They had a range from this to this, because again, people apparently there is evidence that people are more likely to respond if you give them a range rather than.
Oh yes, for sure. But even if you don't talk about the amount, but just the like propensity to pay, like whether or not you have paid, rather than how much you have paid. And that sort of brings me to the second answer, which is linked to the fact that you're absolutely right that people don't normally pay informally for a given service, but they pay in order to build a relationship with the provider. And informal payments shouldn't be seen as this discrete event that happens once for a service. Of course, there are cases in which this happens, but in a lot of cases, it's this continuous chain of exchanges between the provider and the patient that goes throughout time and builds social capital. And I think for that, it really needs to like this is a complete change and overhaul in the way that informal payments are conceptualized in so many of these surveys, again, by TI or the Commission or Afrobarometer, where it's really just, have you paid extra for a service? And when you think about it, it's even in the definition of informal payments. So many definitions of informal payments relate to an additional payment for a service that you're entitled to, right? It's not talking about the structural sort of network aspect of it. So I think that's a very, very super interesting point. I have no idea how to measure that, because obviously it becomes substantially more complex, and I would be very, very happy to perhaps hear more about your experience at some point. We can talk about it more. Yeah, but thank you so much for your questions.
Thank you. Yeah, sorry. Yeah, I realized that. I think we've got David who unmuted themselves, so please go ahead.
Yes. Thank you very much for the presentation. My name is David Chutola. I'm with Osaka University. I'm joining from Japan. I'm wondering how this framing could be done in a different for different types of corruption. You know, your presentation has only covered bribery, but in an African context, bulk of what is happening around corruption in health is largely not even bribe, because largely people who visited these hospitals are low income, so they are unable to pay with bribe. Then, but how do you capture things like absenteeism, or doctor referring a patient to their own private clinic? So I'm wondering how best the framing could be done in that context.
Yeah, I think that's a great point. Obviously, it requires a very different approach, because it will be a survey targeting. I mean, it could target patients as well. How often did you go to the hospital and the doctor wasn't there? But it will most likely be targeting providers. And in that case, I think referring to rather maybe not necessarily the neutral and loaded framing, but the forgiving and non-forgiving framing, which is used in sensitive topics, would be really interesting. So sort of normalizing the behavior in order to elicit a more truthful response from the provider when it comes to things like absenteeism or dual practice. And then using a non-forgiving, sort of the more standard approach, which is, do you refer patients from your public practice to your private one? And comparing how these things differ would help us understand the impact of framing for those types of corruption. But I personally haven't seen anything on the topic. I think it will be really, really interesting to see whether it has an impact. It most likely will, because again, framing, I mean, generally tends to have an impact for things like this. But Yeah, I think it will be, it's a very good point. I've focused on informal payments because it's something that is most commonly measured, right? Like
Yeah,
it's
yeah,
the type of
yeah.
corruption that we measure most often.
It's quite common actually, because Afrobarometer also, I think they have a question around that also. But
Yeah.
the biggest corruption that is happening within particularly the smaller health sector in Africa is largely around absenteeism of medical personnel, referring or stealing of drugs and stuff like that. So
Yeah, and I just can send some references around because our team has published a lot on absenteeism. We focus on absenteeism. And I think this is really a big important. Sorry, I know that Christina is waiting, but for later question, I think I was wondering whether at certain point we could have other seminars looking at other types of corruption. For example, favoritism or using connections or various other kind of things, as you said. There are lots of types.
yes.
Yeah.
Yes.
This is
Thank you
suggestions for
very much.
Joseph.
Thank you.
Thank you very much for your
Yeah,
question.
and Joseph is here, but I'll also pass on this message.
Okay, great.
Yeah.
Great.
Eva, do you want to address before we give the floor to Christina, or?
I think we addressed it, but I
Okay.
think we can continue.
Okay, great. Let's have Christina. Thank you.
Hi, I'm Christina. I'm from Institute of Sociology of the Czech Academy of Sciences, and I would like to thank Iva for a very interesting presentation, because this is also something that we are doing a lot in here in the Czech Republic, and it's really fascinating. I love the topic. And we did a survey last year on corruption in different sectors in the Czech Republic, and healthcare was one of them. One of the more interesting ones. And we were asking about different forms of corruption. And one of them was the informal payments or gift giving. We were asking specifically about gift giving in addition to other ones. But the gift giving especially was an interesting one, because the respondents there was a little bit of backlash from the respondents saying that it's not a corruption, it's just a gift. And they were really unhappy with us framing it as corruption. So that's really, interesting to me to see the results you did on the Eurobarometer. But my question was a little bit about translations of the questions, because I was really surprised by Poland. So I was thinking maybe, the translations were a little bit off, or not, a little bit more loaded than, you would expect. So I was thinking maybe if you, checked on this. Thank you.
So thank you so much. I find the fact that there was backlash quite, not too surprising necessarily. And I think, again, it feeds into the idea that there is a dissociation between what others are doing and recognizing that that might be wrong, and what I am doing, and kind of labeling that as a potential wrongdoing or corruption. And all the excuses sounds really punitive, but all the explanations that one can give to themselves when it comes to this. But yes, the translation. So we went back to each country's questionnaire in the language that they were administered, in the local language, and reverse translated it from English, and then to English, and then from English back to the language in which it was administered, and compared if there were any differences. And there weren't any differences anywhere. Of course, again, when it comes to the Eurobarometer, things are translated very literally. So even the word bribe has a different potential strength, perhaps, across countries. So as you said, it can have a different level of how loaded it is perceived. Yeah, so that could be one of the potential drivers. But as far as we are aware, and again, we try to make sure that there were no linguistic discrepancies. There could be contextual discrepancies, but again, I don't think that's necessarily linked to the language, but it's more linked to what is a bribe perceived to be in one setting versus another, and how that might drive differences in responses, rather than it is a linguistic difference in the sense that language carries a different connotation across context, but just purely on a translational level, it was all uniform.
Okay, great, thank you. I don't know if Christina has got any follow-up questions, or do we have any more questions or comments from anyone?
Yeah, hello. I've got more a comment than a question. I'm Kinga Vajda and I'm from Hungary, from the Integrity Authority. I'm a researcher here. And first of all, I would like to thank you, Eva. It's super interesting presentation. I've got, as I said, more comments than questions. When you ask about the optional differences between Poland and Bulgaria, it's very quite expensive or interesting. However, both belong to Central and Eastern European countries, and three topics came to my mind. First of all, the very strong cultural differences between these post-Soviet countries. As I mentioned, I'm from Hungary, and we see that there are massive differences in several variables compared to other Central Eastern European countries. And of course, we need to talk about the recent policy changing around the data collection. I don't know that when this data collection actually happened, but it could also cause major differences, I think, in the what the people who involved into the survey said. For example, in Hungary, 2 or 3 years ago, we have a very, very strict rule for health professionals not to accept a bribe. And the patients also can punish if they give it. So the loaded framing is getting out from the view, I guess. And I think that neutral framing is getting more and more used here in Hungary. And last but not least, trustworthy sampling can also affect, I think, data collection. So it is also a very interesting and important question. Is it a real probability sampling, or have you got a kind of countrywide address list when you start data collection, or you have more a pool where you collect the sample, because it's affect a lot also, I think, the answers.
Yeah, no, thank you so much. Those are great points. So in terms of the data collection, the Eurobarometer specifically took place before those changes happened in Hungary specifically, because it was about 10 years ago. When it comes to the sampling, I mean, there could definitely be some limitations. Again, when it comes to the Eurobarometer, we were using their data that carries its own set of sampling issues and so on. But when it comes to our data specifically in the experiment, again, we use the commercial provider, which has a lot of sort of limitations associated to it, but it's generally used in the academic literature. And otherwise, I think, yes, I think this idea of like the difference even between Eastern European countries is really, really interesting. And whenever I was presenting this paper to my department and my old institution, people were always trying to kind of understand, like, oh, but it's a regional difference or it's a corruption difference, and that's where these discrepancies are coming from. And it's like, it's really not. There is just some underlying difference in the tolerance of corruption that at least I personally am not aware of a cross-country survey or like study in Eastern Europe that systematically talks about it in different sectors also, because of course the way people behave with doctors is different to the way they behave with teachers or social workers. And so but it's really, really interesting. And yeah, thank you very much for your comments. And I would be very happy to hear more about what you've been working on as well when it comes to this.
Thank you.
Okay, great. Thank you, everyone. And thank you, Kinga. Okay, we almost wrapping up. Do we have any final comments from anyone, or is there?
So I wanted to make this comment. Recently, one of our students did analysis. She's from Hungary, so she looked at Eastern Europe. She did a paper, looked at the different countries over time and how trying to kind of extrapolate what are the payment patterns. But unfortunately, we were looking at data, exactly as you say, there is no good source. We were using WHO collected out-of-pocket payments. So it's not, obviously, not all of those are informal, but we know that a large percentage are informal. So we try to use that. And I was wondering, one of the things would be, as a result of this growing interest in corruption, to lobby WHO, because in the past, with the European Observatory for Health Systems, they were collecting data on informal payments, but now this seems to have stopped. So I just wonder whether that's something that could be a recommendation to WHO, because they have this pattern of collecting data. What was interesting, we noticed this over time in all the Eastern European countries, very little change, very little change. So despite the changes in financial system, improved financial protection, you have very similar lines. It's almost like continued. So I think that leads to the idea that the social norms continue to be really important, and we need to understand.
But it's not even just Dina, it's not just the WHO Office for Europe that has stopped collecting data on this. The Eurobarometer also stopped collecting data on bribery. The Life and Transition Survey stopped collecting data on bribery. So there's very, very few sources of information on informal payments that are left. So yeah, that's definitely.
This is changing with this Lancet Commission, and we had to have today. I know that our colleagues from WHO could not join, but they are extremely interested to promote this as one of the big recommendations of the report. What kind of measurement do we need to establish as routine measurement systems?
I would like to know what's the status of the study. Is it published already, or is there a place one can access it? I would like to.
Yes, it is published. Wait, I will post it in the chat.
Oh, okay.
I'll post it in the chat.
Okay.
It recently got published, and it's in Social Science and Medicine. It's open access. So there you go.
Okay, thank you.
Great, thank you, Iva, for sharing it, and thank you, David, for reminding us to share this. Okay, I think it's time to conclude, and I would like to, on my behalf and on Joseph's behalf, thank everybody for their participation, and thank you so much, Iva, for sharing your paper and your thoughts on this very important topic. This video recording will be shared in about a month's time. So yeah, thank you very much to everyone, and I hope you've enjoyed it. I hope it's given you some food for thought. I've got a couple of pages written with my notes, which I'm going to reach out to Iva about quite soon. So thank you very much to everyone, and yeah, hopefully see you at the next roundtable.